Welcome to the Social Workers radio talk show on WCDB Albany 90.9 FM with co-hosts Dr. Eric Hardiman and Alyssa Lotmore. Here at the Social Workers, we address issues important to our communities with social work students, alumni, and community partners as our guests.
As part of the University at Albany School of Social Welfare, we hope to take social work beyond the classroom and agency settings and directly to the public, because the public is the client. Catch us on air, online, and anytime.
Welcome to WCDB Albany. This is the Social Workers live radio talk show. My name is Eric Hardiman, and I'm here with co-host Alyssa Lotmore. Welcome back, Alyssa.
Hey, Eric, it's another great academic year at the School of Social Welfare with some changes. Do you want to talk a little bit about that?
Change is the norm these days, and yes, there have been some changes. So our Dean Lynn Warner, for personal reasons, has stepped down as Dean of the School of Social Welfare and will be returning to our faculty. In her place, Vicky Rizzo has been announced. It has been announced that she will be Interim Dean and Professor here at the School of Social Welfare. So we're excited to have her on as our guest today, Dr. Vicky Rizzo. And starting this new position as Interim Dean, we're very excited to have her. It's an exciting time. As you said, Alyssa, lots of change, but I think we'll have a great episode today talking with Vicky and finding out about her work and about her ideas for the School of Social Welfare and about the profession and lots of other good stuff we'll touch on, I'm sure.
And she is also an alum of our program and has been here as a professor. So
That's
a familiar face stepping into a very important role. So let's get started with the episode.
Let's get started. So if you've just tuned in for the first time, I just want to reintroduce the show. Our show is called The Social Workers, and Alyssa and I have a regular show here on WCDB Albany where we talk about social work and related issues in the community. Our special guest today is Dr. Vicky Rizzo, Interim Dean and Professor here at the School of Social Welfare at the University at Albany. She has dedicated her career to demonstrating the value of social work in healthcare settings and community-based organizations through her research, teaching, and workforce development activities. Dr. Rizzo's research examines the impact of social work and interprofessional interventions that include social workers on healthcare utilization, health and behavioral health outcomes for older adults coping with chronic illnesses, elder abuse, and caregiving. She also examines the implications of the findings of her work for healthcare policy and the financing of the provision of social work services to older adults and their caregivers. Dr. Rizzo has extensive experience as a healthcare social worker and has conducted research with colleagues at Kaiser Permanente healthcare systems, Rush University Medical Center in Chicago, and the Jewish Association Serving the Aged in New York City. Various foundations, including the Mother Cabrini Health Foundation, the Garfield Foundation of Kaiser Permanente Healthcare Systems, the John A. Hartford Foundation, and the Commonwealth Fund have all funded her research. Since earning her doctorate in 2002, Dr. Rizzo has provided funding and mentoring to doctoral students in social welfare and social work, and has served on more than 30 dissertation committees in multiple disciplines, including social work, economics, nursing, education, and engineering. Vicky is also the president of the National Association of Social Workers New York State Chapter Board of Directors, a distinguished scholar and fellow of the National Academies of Practice, the Social Work Academy, a fellow of the New York Academy of Medicine, and a John A. Hartford Geriatric Social Work Faculty Scholar. Welcome, Dr. Rizzo. That's quite an impressive bio there, and we are, you're a welcome, familiar face on our faculty, and we're glad to have you step into the Interim Dean position, and excited to have you here on the Social Workers today.
Well, I'm glad to be here too. Whenever I hear my bio, I'm like, oh, that's just a little too much. We got to shorten it down a little bit.
Well, when you've done so much and achieved so much, it's important to list it all. So congratulations on your career to date, and congratulations on being named Interim Dean. And we're looking forward to seeing where this goes from here.
I am too. It's quite an honor to be appointed as the Interim Dean.
And your bio said a lot and it showed how much you did accomplish so far. But let's start back a little and go from the beginning of how you even got into the social work profession. Can you start off by telling us a little bit about why you entered this field?
Oh, absolutely. So I actually began my career as a high school English teacher. I got my undergraduate degree at the College of St. Rose up the street. And I had two different jobs as an English teacher. One, both of them in rural school districts. And one was actually my alma mater. I was a teacher at Galway, and that's where I graduated from in 1981. And so I was also a track and field and cross country coach and in the olden days when I was a teacher. And I really liked interacting with the students. And then they would talk to you about what was going on in their lives, the personal issues. Not just the athletes, but students who were not doing well in class. And I had, in New York State, you have to get a master's degree to be permanently certified as a teacher. So I started a master's degree in English, took one course that focused on Emily Dickinson, and thought to myself, how really is this helping humanity, getting this master's degree in English? And so I looked at three master's degree programs: psychology, guidance counseling, and social work, and decided that of the three, the master's degree in social work was the most versatile because, as you know, we work everywhere. We work in all sorts of different places. So I applied to the school at Albany and was admitted and took a year's leave of absence for my teaching job. But then after that 1 year, resigned, knowing that I didn't want to go back to teaching. So that's kind of how my social work career started. But the very funny thing about it is when I was at the College of St. Rose, many of their dorms are houses, on Western Avenue. And I lived in a house that on the third floor, there were two rooms. My roommate, who was an art teaching major, and I were in one room. And there were three social work students in the other room. And I always used to say to them, why would anyone want to be a social worker? And so they've never let me forget that because now I can't imagine being anything else.
Yeah. It's funny. I mean, your story is really, it's wonderful and fascinating to hear how you entered the profession. But I think that the last point you made, not being able to imagine anything but being a social worker, I think that resonates for lots of us in the field, that once we find social work, we start to realize that this was, this is sort of how it was meant to be for us. Yeah.
And I'm just still stuck on the fact that I had no idea, me being the track and field athlete at Albany for so many years, had no idea you were ever a track and field and cross country coach. I don't know how that didn't come up in conversation before, but we'll have to talk about that off air.
Yes, we will, because I also was a runner in high school. And when I turned 40, Catherine Breyer Lawson, another faculty member at the school, and I ran the Marine Corps half marathon.
This is like fun fact episode as well, because this is great.
That's exciting. Yeah. So tell us a little bit about your research. The bio talks about healthcare research and sort of interprofessional activity and lots of different areas that you have explored in your research. But if you could sort of tell us, since your days getting the PhD, how has your research focus changed over the years? And, just tell us about what really excites you in your current research too.
Sure. So I think that the reason I came back to school to get my PhD was because I was working at Sunnyview Hospital in Schenectady as a social worker. And, the role of the social worker there, there's case management, there's individual counseling, family counseling, group support, all of those things. But what I was noticing when I got into the position is when utilization review just started being a thing in the late 80s, early 90s. And what I was noticing is there were like such huge disparities in what my clients could get depending on their insurance provider. So I may have a client who is a Medicaid recipient who actually could get more durable medical equipment and home care services than someone who was privately paying for insurance and couldn't get those services. And it wasn't like I thought everyone should be getting what my Medicaid client was getting at that time, so they would get home health care and things that the private insurance wouldn't pay for. And I would have clients whose wives would have to quit their jobs because I worked on the spinal cord injury unit. And most of those people are working age, and a lot of them are high risk taking males. But I also worked with stroke patients too. And, both of those populations need lots of equipment. So, I was a social worker there for 8.5 years, and it was just making me really angry that there was this disparity due to insurance coverage. And so I decided, I was a field instructor at the time, and my students were telling me everything that was going on in Albany. And I'm like, I think it's time to go back and get my Ph.D. because we need to change policy. And we also need to change the way social workers are reimbursed. They shouldn't just get reimbursed for, counseling. They should get reimbursed for case management, advocacy, all those other things that they do. And so I came into the Ph.D. program. And from the very beginning, my mentor was Janet Perloff, who is now deceased, but was a faculty member in our school and the School of Public Health. And from the very beginning, I knew I wanted to conduct intervention research to demonstrate how social work, the unique contributions of social work, what social work does that can affect outcomes for patients and their families. And so my first study, I actually did the study at my workplace, and we had lots of data. And there was a psychologist at the time who was collecting data on depression in post-stroke, which was a very new area at that time. It's now very well developed. And he had lots of data. And so I decided to look at using case records, what services the clients got from the social workers and how that impacted their outcomes in terms of length of stay, whether they went home or they ended up in a nursing home or assisted living, et cetera. So that was my first study. And there were some significant findings, people who got certain types of social support did better than others. And so that was my dissertation. And then I really didn't at that time have a focus on working with older adults, but most of my adults were older adult. Most of my clients and their families were older adults because 80% of the population at Sunnyfield was older adults. But I started, Susan Sherman, who was also a faculty member at the time, kept telling me I was a gerontologist. And then I worked with Ron Toslin in his center. And he actually taught me how to do really good intervention research and by working on his projects. So the populations of my work have changed, over time. So, my first study was with stroke patients, but some of them were old, some of them weren't. And then with my work with Ron, it was, caregivers. We focused on caregiver support and caregiver interventions. And then with Kaiser Permanente, which was a study that also Ron was involved in, we were looking at advanced illness care planning. But again, it was an intervention that included social workers in primary care and what their contribution was to the team. And so then it's always been, all my work is always about what contributions do social workers make that influence outcomes, with the ultimate goal being to change the way we get reimbursed by Medicare and Medicaid and private insurers. So, then when I went to Columbia, it was much harder to connect with the hospital systems there, even though there are some very famous hospitals in New York City. So I partnered with the Jewish Association for Services to the Aging, which is the largest provider of social services in the nation to older adults, and hires 80% of their employees are social workers. And so I did my work there. And that's when I focused on like elder abuse, caregiver support programs in different languages, because what they wanted to do was they wanted to have scientific evidence that what they did worked, so that they could go to the city council and to DFTA, the Department for the Aging, and say, we need you to give us more money, and this is why. So again, it was still primary intervention work. They have a very unique elder abuse program there that we studied. We did some of the first studies that really evaluated the impact of social work and elder abuse programs. And, since coming back to Albany, when I was at Binghamton University, I did a very large study with Rush University Medical Center, again, primary intervention, looking at the roles of social workers in their primary care clinics. And And now my work kind of shifted since I came to Albany, and I can talk about it more on the show, is that I've really now, since I became a full professor, have shifted my focus to training the workforce.
Okay.
So training the workforce so that, students, when they graduate and people already in the workforce, can really be prepared to work in the environment we live in now, which is so much more fast-paced than when I became a social worker 32 years ago. So I had a grant from the Mother Cabrini Foundation to train students in an independent study on the importance of social determinants of health, screening and assessment for social determinants of health. And we identified food and nutrition programs for this study, specifically Meals on Wheels, programs that don't currently have social workers in them, where they're needed, because of course, home delivered meals programs serve the most socially isolated older adults in our communities. And so it was a course, and they actually did drive-alongs with the home delivered meals drivers. They made wellness visits and calls to people so that we could begin to figure out how can we incorporate interns into these programs, and then eventually make a case for social workers to be included in these programs.
So it sounds like all of your work has had this through line of social work intervention and I don't want to use the word promotion, but articulation of the unique benefit that social workers bring to healthcare settings and bring to work with various populations. And that, to me, that's very exciting, that in society, we've talked about this a lot on the show, Alyssa, that a lot of folks out there don't know what social work is, and maybe they've interacted with social workers minimally, or they've seen a TV show or a film that maybe has a character who's a social worker, but they see, just a tiny slice of what that activity might be and don't fully understand what social work is. And so I hear in all of your extremely exciting research work that there's this, this drive to better articulate what the benefit social work, what are the outcomes that social workers work towards and help make happen for people.
Yeah. And you started off saying, why would these individuals across the hall from me want to be social workers, to then getting frustrated after you're working to saying, I want to go back and make change, then to work with names like, Janet Perloff and Ron Tolsland, who is a distinguished professor here, to being the interim dean of that same school where you're working with these distinguished faculty. I want to know what that's like for you to, looking at with the story that you just told of how you got into this field, to then coming to the School of Social Welfare as a doctoral student, getting introduced to the aging profession, becoming more of in the gerontology field, working with these researchers, and now being the interim dean of that same school. What is that like for you?
Well, if you had told me 5 years ago that this is the seat I would be in, I would be like, yeah, no, that's not happening. But I consider it a great honor. My experience, both as an MSW student and a Ph.D. student, that the faculty that I was trained with and who taught me were like really well-renowned people in the field. William Reed, Ricky Fortune, Catherine Breyer Lawson, Janet Perloff, Carolyn Smith, like all of these people were very distinguished in their fields. They all had various different research expertise. So to sit in this chair is an honor, but also a great responsibility for me, because I just love the School of Social Welfare and I love the University at Albany. So I came back to the University at Albany. I was at Binghamton before this as the chair of their social work department. My family all lives here in the Capital Region. I have an aging mother. So, my plan had been to come back to Albany and be a faculty member, do some good research. Now that I'm a full professor, I really wanted to concentrate on, learning how to teach really good online, all of these things. So, I said to Ricky Fortune yesterday, who is cleaning out her office because she retired, and she had a huge picture of Janet Perloff that we used for a fundraiser many years ago. And she said, I think you probably would want this picture. And I said, wow, if she could only see me now, because the interim dean at the School of Public Health, Mary Gallant, was also mentored by Janet Perloff. And so here we are, these two interim deans who were both trained by the same person, which speaks very highly of the caliber of our education and training at the university and in our professional graduate schools. I also think that what's really important, as I was told by one of my mentors when I graduated with my PhD, that I had to go away. I couldn't stay here. I had to go away. And so I did. I went to Columbia for 7 years, and then I went to Binghamton. And so I feel like I have a good perspective on how social work works in other institutions, both publicly and privately. And so that I came back with a much broader perspective of social work education. And I think that will serve me well.
So speaking of that broader perspective for social work education, it's a time, I think higher education right now, generally in the US and even globally, this is a time of change in higher education. And we're hopefully coming out of a pandemic right now, emerging on the other side. The social work profession is constantly in flux and changing. And so I wonder if you could talk a little bit about your vision for the future of the school of social welfare and kind of where you see our school headed here at the University at Albany.
So I think that there's great opportunity for yes, higher education is changing a great deal. And we have to think about higher education and generally, how does it need to look different to respond to not only just young people, but to non-traditional students, to older individuals, to first generation students, people from underserved populations, and really think about in our processes, our admissions processes, the way we structured the program, like how does that create opportunities, but also how does it create barriers? We really, when you speak to people at the Council of Social Work Education, the National Association of Deans, the New York Deans, we all know that we want to recruit a more diverse social work workforce, but we can't do that if there are barriers embedded in the structures of our programs. And I'm not talking just about ours, I'm talking about nationally. So I think there's work. The social work, just like higher education, is at a real crossroads. Our profession is at a real crossroads too. Who are we? Do the educational standards of CSW make sense? CSWE makes sense. There's no scientific evidence that, the 2-day a week internship makes better social workers than a 1-day internship. So there are all these things that I think that need to be considered at the kind of the national accrediting level. In our school, we've had a very strong reputation for research. And what being a faculty member, and now that I'm in the dean's role and having conversations with different faculty, one of the places, which is a focus in my role as the dean, but also as the president of NASW, is that we need to grow the workforce. There is a mental health crisis. There's a child welfare worker crisis. There's a policing crisis. There are all these things that are crises that social workers can respond to. And so we need to have as part of our program, again, we have a history of this with the Internships in Aging Project, with your project, Eric, the AIM project, through the Office of Mental Health, and through the NICWE, the National Child Welfare Workforce Initiative. All of those are very important areas where social workers can make contribution, and we're training students to work in those areas, but we are also training professionals, right? We're doing continuing education. And so I think that our school, I envision our school doing more of that, more workforce training. Carmen Morano now is doing the Accord program, which has social workers and EMTs working together. And then we have the simulation with the theater department, which is training students in real time with actors to do interventions and motivational interviewing and different techniques. And so I think that could make us a leader. I think that a lot of schools are focusing on research, and we are too, But I think if we can combine the research with workforce initiatives and demonstrating how they make a difference and how we're actually contributing not only to the profession, but to society by helping to address these like severe needs. You know, school social work is another big area where there just aren't enough school social workers.
That's exciting. Thank you for sharing your vision.
And it's really exciting also is that we are located on the downtown campus in the capital of New York State, so close to the Capitol where policy and laws are getting made. We're in our community downtown with so many nonprofits. There's so many ways that we can make a difference. And I'm always one to say like that the university, the university should be actively involved and a part of that community in which it resides. And I think we are doing that as social workers out and about with the internships, getting more people into the workforce, whether through interning and then as young professionals and returning students who are coming back and entering the field and going back with a higher level degree into their workplace. So we're doing a lot, and I'm really excited to hear some of the things that you're thinking about, enhancing at our school. But it's not just the school that you're doing. You're also you were recently elected the president of the National Association of Social Workers, New York State Chapter. So congratulations on that.
Yeah.
So tell us a little bit about that role and what are your goals for that position? Because that has to do with a lot of our policy and the whole social work profession.
So, so Sam Fletcher is the executive director of the New York State chapter of the NASW. And of course, she's she's an alum of our Ph.D. program and also a former assistant dean in our school. And she and I had many conversations. I was serving on, it was called the Value of Social Work Task Force, which NASW had created. And I was serving as the chair. And I decided to run for president because I really do believe our profession is at a crossroads. And there are lots of other professions that are trying to encroach on our space. I mean, there's room for everyone, right, to work. There's plenty of need. And so when I was elected president, the issues that I was not expecting to be the interim dean. What I was like, I'm going to run for the president because I'm a full professor now and I need to give back to the profession. And this is another way I can give back to the profession. So there are a couple of issues. The platform that I ran on was really to address licensing issues, which are done state by state. And DOD, the Department of Defense, is funding what's called the Interstate Compact, which is supposed to provide portability of social work licensing, but it sounds really simple, but it's really not simple at all. And New York State has never joined any compact for any profession. And we're not, the way it's written right now, there's debate on whether it would be the best idea anyway. But so I ran on the platform of looking at licensing in New York State and also workforce initiatives. Like, what can we do to make this an more attractive profession? What can we do through policy, like loan forgiveness, increasing salaries at state-run agencies, these kinds of policy initiatives? But the major one is licensing. So over the past couple of years, of course, the pandemic played into this, it takes a very long time for a graduate to get their initial license, their LMSW, or to get their limited permit, which allows them to practice as a social worker before they have completed the licensing exam, right? So we've heard of wait times of like 70, 80 days before, and that's if the person passes the exam, the national exam.
Right.
So there are also very significant problems with exam passage rates. So back in 2016, when I was the president of the New York Deans, the New York Dean Society commissioned a report, which was done by the Center for Workforce Studies at the School of Public Health, to look at passage rates and to see if there was bias in the exam. We have great concerns about people of color, older non-traditional students being able to pass the exam the first time. Now, why is this important? Well, because you just spent a lot of money going to school to be a social worker, and you can't be licensed until you pass this exam. So that's number one. Then every time you take the exam, you have to pay a fee. So it can run into thousands of dollars. We've heard stories of people not passing 8 times.
But can we also just pause and say
Uh-huh.
that it's not the passage, it's not like they're not learning the same content, it's how the questions are worded and the answers. And I want to just
Right.
have that distinction, because
Exactly.
sometimes people are like, well, it's not our fault that a person of color isn't passing the exam, but it's how the questions are worded
It's
to
bias. Yeah.
Yes.
Yes,
So I just want to
exactly.
make that
It's how the
distinction.
questions are worded, and it's also about cultural bias.
Yes.
Like
Mhm.
if you're a Native American, and you come from a collectivist society, how you might answer questions would be very different based on your cultural upbringing, based on how your community works. What might be the right answer to like a white privileged person who's not in a collectivist, is in a more individualistic frame of mind, might answer differently. So yes, it's about the wording of the questions. And so at first when I became the interim dean, and it may sound like I'm rambling, I was like, oh, I don't know if I can do these 2 jobs at the same time. But then I was like, the issues that I'm concerned about for the National Association of Social Workers are the same issues for the professions that schools are concerned about. So this exam, ASWB, the Association for Social Work Boards, just released their first national study on data. They have refused to do it for years. After we did our report, the whole purpose of doing it, showing them the data, was so that they would partner with us to do a real study. And so the results were not good. Only 57% of Black test takers passed the first time, where 91% of white test takers pass. White women have the highest passes rates. Women test takers who are over the age of 50 have a much lower passage rate. So this is just beginning data, right?
Mm-hmm.
And it's flawed data because everything is self-reported. So a lot of people can choose to not self-report. But you're right, Alyssa, there has to be a deeper dive. So why is this? Who's writing the questions? And do the questions really reflect what's being taught in our social work programs or not? Because, a lot of the questions on the exam are clinical. We have lots of programs that are very we have a macro track, we have advanced generalist programs in the nation. So those are the questions that need to be asked. But so my goal as the president, and I think the New York deans are also looking at this. We're trying to get schools involved, all of the schools in New York, around this issue of the licensing exam. In Illinois and Rhode Island, they have actually been successful at changing legislation so that you do not have to sit for the first level of examination. You're still licensed, but your license, your diploma is your proof that you should be a licensed social worker. If you graduate in good standing from an accredited MSW program, that's how you get your first level of licensing in Illinois and Rhode Island. So then what this also does is it puts whatever kind of social work you're doing on the same playing field. And then if you want to be a clinician, you can sit for the higher level exam, right? But if you are going to be more of an advocate or a government relations person, or you're going to work at a university, or you're going to work in some macro capacity, you're still a licensed social worker. And so that, I think that helps demonstrate what social work is broadly, right? These are all licensed social workers, and look at all these things that they do. So I think one of the things that, my goal is that we could be successful in getting rid of this barrier, because it's keeping the people we want in the profession out of the profession, some of them.
And I just want to clarify, if they still would have to apply for licensing, even though they just graduated, you'd still have to apply, still do continuing education credits.
Absolutely.
It's just you're not taking that initial test, which is the data shows is flawed anyway.
Right. Exactly. So there are the National Association of Deans and Directors are really, they think that this data that has been released by ASWB, it is very concerning. and like a crisis that there needs to be action taken on. And
Mm.
so, I'm hoping that one of my goals is that the National Association, the New York Deans, and the National Association of Social Workers, New York State Chapter will all be able to work together, because we know in advocacy, and certainly with the New York State Legislature, you have to have lots of voices who are also constituents to come to some, place of agreement. So licensing is a big deal, and also salary. NASW did, at the request of some legislators last year, do a salary survey of what social workers are paid. And, one of the things that we're focusing on is really pressing hard for salary increases.
Mm-hmm.
I support that. It's hard when you graduate. I remember my first job, I was making a very low rate with my license out of grad school, doing home visits. I was constantly working. I was responsible for students, making sure that, the parents got their meds refilled, all the stuff that was completely important. I was working in a school setting, but really important. And I was barely making anything when the taxes came out, and when my health benefits, all the money that I had to pay came out of my check. It was a very small check. And I'm like, how is this, for all that I'm doing and all that I'm doing to help individuals and make, this work? Why are we not being compensated? And a few of my colleagues ended up going back to school for a different degree, even though they loved social work. They couldn't afford to stay in it.
And we all know this work is so important, and it's so important here at the School of Social Welfare for us to be able to attract new students to the profession. Let me just reintroduce, if you just tuned in, you're listening to WCDB Albany, and the show is called The Social Workers. And we have with us, we've been talking with, and we'll continue for a few more minutes to talk with Dr. Vicky Rizzo, who is currently the Interim Dean and Professor here at the School of Social Welfare at the University at Albany. So with that in mind, Vicky, thinking about social work and what attracts people to social work for the first time, we always say that there's a need for social workers now more than ever, that there's, we're just realizing there's so many areas of need in our society where social workers can intervene and produce change and really work together toward meaningful social change. What would you say to someone who is considering entering the social work profession right now and maybe considering coming back to school, and social work comes on the radar, but they're not really clear what social work is? What would you say to someone like that?
Well, I would say to them that we're much more than clinical therapy. That's what I would say to them. And I would say to them that if that's the only thing they want, I mean, social work is a good place for that, but we're much bigger than that. So we have a commitment to social justice. We have a commitment to marginalized populations. We have a commitment to addressing, the wrongs that are occurring in our society, and so the degree in social work positions you well to address those issues. And I think the other piece is that not everyone wants to do clinical counseling, right? And that what social work provides, that like licensed marriage, family and marriage therapy, and like licensed mental health counselors, what we provide that they don't is this real understanding of the person and environment fits, how like the social determinants of health can impact someone's life, so that as a social worker, there's opportunities to impact the system in many more ways than just counseling, right? You can help people be connected to resources that they need. You can be an advocate to fight for certain policies to be changed, like fair housing policies, having affordable housing, food insecurity, all of these things. And I find that when I talk to students who are either in our program or students who are thinking about it, more and more, they're not telling me they want to be just a counselor. They're telling me they want to be activists or advocates. They want to address some of these larger problems. And a degree in social work allows you to do that. But you can still also do the clinical piece, which I think sets us apart from everybody else.
I would agree with you. And social workers fight for economic justice. They fight for social justice. They fight for environmental justice. There's so many areas where social workers are involved and can be involved, but which the general public don't often necessarily associate with social work, which has traditionally been more associated with child welfare and removing kids from families, foster care maybe, and some mental health and counseling. But it's a much broader profession than that. And you did such a nice job of articulating some of those areas where students could get involved and could find careers and develop careers. I mean, I often think about the social work careers of the next 5 to 10 years are still being created. There's going to be areas where social workers get involved that they haven't been involved in the past, and there's new opportunities. And even things like our podcast, social workers getting involved with the media, social workers, becoming public figures, social workers being elected into public office, even.
That some of our alums have been elected into public office.
Yeah,
absolutely. So to us, that's really exciting, and we're thrilled that you've been named interim dean at the School of Social Welfare, and it's been such a great pleasure having you on the show. I know Alyssa had a few more quick questions for you.
Yeah, so we've never done a type of rapid fire questions, but I thought to get to know you a little bit better, since you are the new interim dean and people want to get to know you, we'll have some rapid fire questions with quick answers. Do you think
a lightning
you're up for
round?
That?
Yeah.
Sure. It'll help
right.
practice for lightning talks, right?
All right, here we go. Cats or dogs?
Dogs, for sure.
Summer or winter?
Summer.
Would you rather fly or have super strength as your superpower?
I would like to fly because then I can see things from a very broad perspective.
I love that social work answer. Do you watch shows one episode at a time, or are you a binge watcher?
Oh, I'm a big time binge watcher. I want to watch it all at once. I hate waiting.
So if we ever don't hear from Vicky for a little bit, responding to emails or something, we'll know why. If a new episode of something or a new series of something was released on Netflix.
That's right.
And last one, would you rather travel to the past or to the future?
I would rather travel to the past, to two eras of significant change: the Elizabethan age, where we had the explosion in the arts, and the 1960s, when there was such change. That's because I still think I could learn from being in those time periods.
Interesting. This has been so great, Vicky. It's been really nice to have these conversations, and thank you for answering the lightning questions and allowing listeners to get to know you a little bit better. If you're a listener out there and you're listening to the social workers for the first time, these are the kind of conversations that Alyssa and I like to have with our guests. We like to find out what's really brought people to social work, what motivates people to continue in the social work profession, what are some of the successes and challenges they face as social workers. And then we also look at community issues. What are some of the pressing needs of the community where social workers might get involved, and where social workers might interact with other professions. So to us, this time that we have on the Social Workers radio show and podcast is just a great place to have conversations and meet new people, and really to get us all to think a little bit differently. So thanks for being our guest today.
Thanks so much for inviting me to be on. It's been great spending this hour with you.
So you've been listening to WCDB Albany. My name's Eric Hardiman, and I've been here with Alyssa Lotmore. Alyssa, do you want to share anything at the end?
Just you can catch us on air, online, anytime. So we hope you come back. We have a few exciting shows already lined up for us. So stay tuned.
Stay tuned at the same station here at WCDB Albany. You can also catch us on podcast and lots of different places online. Thank you for listening. This has been the Social Workers.